afternoon, everyone. Just wanted to let you know that if we do need to have an update this weekend, I will be in touch with all of you. I'll send a note to media, and also we will post on Premier and Government of Nunavut social media if there is a need to update you on anything, and hopefully we can also have it broadcast here. Dr. Patterson will speak after the Premier, and then we'll go right into questions. Thanks.
Nunguani tu saat saharutaha Iqaluit pivalle yuleriyini sibulertiulu ammalununa vugava makungita tukisigaarbingani tukisigaarbit saummiyu takut sautu inare tu saat sakta kanutaani nunguani Dr. Patterson okhali malawluni apiqsulangammiyu
Ublucha Nunavut ma no yotana nuwan na yo 19 atahu laumat Nunavut iloni ma na huli atahu nanguyo Amamana motikiluta kwa kawi hakto himayut nuwan na yo 19 kangi mga ta katilugi 602 kawi hakto himayut 196 huliutak kayavuta nuwan yo 19 kangi mga ta amakawi nakto 406 hungito Ikpakatay mata kwa tuwagang naktukuta kwa anya tuleri kuta pileri mitsimatiling mulaw mata taik matikit na tom mata pileri law sutit takwa anya we pileri ni pileri katikak sutit amanay ngwanit takwa nokangi nasluni pileri mata taikani mitsimatiling mi takwa kawini luktut Tan nuwan na yo 19 kakto kinami aktui yudlo ayang na mga ubalu ba kinami aktual law kimang na mga o kanigilaw na mga tan nakawi hang na ato hokto tan nuwan na yo 19 aitu lui nekpat kitut aitok taw himang mga ta maubla to halaw na la kapitan na tabani iglo mi ikiwan ni hokto ta upangakut nokak himalaman dan maligaleo ti okak tinga okalaw matana mana nokanganya ikiwalang itu upenga mitabani apekho te kana opitana okak ti tidara we anu tai ko apekho tikata twak tu lui tana taw anu tango yo May 7 pigalu ta ko nunu mutat nunavun hilatani tut nunavun itewatut ingmini akiliga kattaumali taikani hinik tawing mi inutu hivig mi taikwa 14 days tukihin na tiyang na wat manaw yok taikwa hinik tawing mi tu ublu 14 in government kut akilak takta manaw yok May 7 tikip patakwa May 7 ungatani nunavun mi outlock tut outlock wa mer sutit Nunavut itera pata taikani hinik tawing mi ublu 14 inutu hiving mi akiligia taumali ki henita kwa anya nikut anya mi outlock tu ta kwa government ko akilitu inatana tangita kwa ihumaluga kang itu ta kwa anya mi outlock tu tuwang na tu ko outlock tu ta kwa government ko akilia tana tangi huli Dana pijito yo okak himat takap tatakwa Nunavut hilatano outla ko yung isuta pigakad lakik to kiheni outla ko kaptigo Nunavut hilatani kiheni takwa ihumak hosutit outla ko amertut akilita kaya kang nalang mata May 7 ungatani Nunavut mi aning pata tabatakwa akigiyaw niyan inuk ataw hilpat ikami taikani hinik tawing mi 2,100 ublu 14 akilinia inukak kanak patay kan ikami 1,050 akilik kaneluni ama inukak kanil patan na hulita 1,050 akilik kaneluni tukihin na tiyang naman dan hibulak pa inu ikami to 2,100 makok pata dan 2,100 ama 1,050 akililuni inu pingahuk patay ikami 2,100 ilalo ni 1,050 ama ilak kanili 1,050 takwa kaya akakang nalita kani inutu hiving mi kabdunano nani ama takwa kawi manginap ta kanga kudana nunavumut kano Nunavut miutang ito kaku itaktulang na mga ta Nunavut ama Nunavut miutat iteruartut inutuuving migiaqarlutit taakua qauyimajaunearpu Nunavummiutut ihumaqorluni Nunavummi aullaruarpata taana akiliittariaqarnaalermata Nunavummu iterearpata taana May 7 pianikpat taakua qawinnarniat imla qawikkaneruarpata qawigaartuului Dr. Patterson titerarvianu matana kingullerpaaru ngulugu taakua Nunavummiu uqaujikkanneruartaqa taakua nuvannerjua 19 mikhaanut nalautaa tangiluta kinaumangaa taana aanniartoq ammaqanor taana aanniarneq qailaumangaa tikilaumangaa taana inuk aanniarneqartu nuvannerjua 19 nakipilaum mangaagu ippakkauqalaumakia tamapta luktaa taana nuvannerjua pinilungi tavut Nunavutmut nakkarnilungi tavut taakua piaaqutaungi tukku taakua aannialertamata nagligihinnarlugit kamagitsaarlugit ikajortorlugit taana tau aanniaruangi mattau amma taakua qaritauyakkut Facebook qoralui taakua hulingituni oqartamata oqaruaruvitaikani qawiga qaarluti taana oqarniartai hulimmangaat naammangaat inungni aanniartuilangi mangaat kataktigilangi mangaa inungnit taakua inoqatigiigapta pitsaaquttigiilluta ikajortigiilluta taakua tamaptaluktaa katingaluktaarluta taana nuvannerjua 19 anigorniarmiyut ikajortigiilluta taana haalaginnaarmit yavun amma hulingitunit tuharakaqarneruvit maana noqqare qawigiarlutti taana hulilluaving mangaat taana unikkaarniartai qaratauyakkut qawiguaruvit tabbani ublukkut tabbat huliyumi oqartartugut Dr. Patterson huliyumi oqartartoq qawiyimayaani oqartartoq taakua oqaruaruvi qaritauyakkut ikajornartunik nagliguhunnartumik tunganartuni taakua tuharuartartavulli Nunavummiutigut taana akkornamamaana te etukulauqimanginapta kiheani ihumatsiarluta nagligiitsiarluta ikajortigiilluta naammangittuni aanniarnartuni hulingituni oqartangilluta taana aniguurniartavut matnaarpaka Nunavummiuta piyut matnauyuhin Good afternoon. There is still one confirmed case of COVID-19 in Nunavut. Today, the total number of people under investigation to date is 602. 196 people are currently under investigation and 406 are no longer under investigation. The rapid response team has been in Pond Inlet since yesterday, and they are working tirelessly with health staff in the community to trace this case and work to manage the situation and care for the individuals and restrict or slow the spread of COVID-19. As you may have heard, the Speaker of the Legislative Assembly canceled the spring sitting earlier today. More information about how scheduled House business will proceed will be available from the Legislative Assembly. And this is new. Beginning May 7th, any Nunavut resident who voluntarily left the territory and wants to return will need to pay for their 14-day isolation stay. Medical travel patients will continue to be covered and are not expected to pay. Please remember that we have advised against any non-essential travel outside of the territory since mid-March. Starting next week, the cost to stay in an isolation hub will be the responsibility of those who choose to travel outside of Nunavut. Despite these recommendations from the Chief Public Health Officer, people have still been leaving. The fee for a single individual in a room is $2,100 for the 14-day period. And each additional family member in the room will pay $1,050. Those fees will need to be paid in advance of arriving in the isolation hub. We do not know when Nunavut's travel restrictions will be loosened, so we cannot advise when isolation will no longer be mandatory. Anyone who chooses to leave Nunavut needs to be mindful of this. More details about this change will be forthcoming and outlined for travelers when they apply to re-entry the territory. In closing, I ask Nunavut Mute to please not speculate on the individuals with COVID-19 or the circumstances of how the virus came into the community. I'm seeing a lot of misinformation, mistruth, and negativity on social media about this. Most of what is being presented are not facts. The facts of COVID-19 in Nunavut are presented here at our updates, regularly by Dr. Patterson and online and on our website. If you are contributing to misinformation or trying to place blame, please stop immediately. To those who are asking for and pushing positively and kindness, I thank you. Not only do we all have a community responsibility to keep one another safe with physical distancing and hand washing and staying home, but we all have a duty to keep each other safe from bullying, rumors, and lateral violence. Nunavut Mute, let's spread truth, good information, facts from the experts. The public health workers who have been keeping us safe and who have been working tirelessly to respond to COVID-19 in Nunavut deserve our respect and our thanks. To make assumptions and misrepresentation information is disrespectful to the work that they do every day. Let's please stay positive, stay vigilant, and stay well, and stay home, and save lives. Thank you.
Good afternoon. I'd like to give an update on the current status in Pond Inlet. The one patient is isolated and is doing well. The rapid response team is in the community and they are implementing containment and contact tracing. As the team completes additional testing, there is the possibility that more positive cases may be confirmed in the community. This does not necessarily mean that there is community transmission and should not be a cause for alarm. What this does mean is that the rapid response team is doing their job, which is finding the virus and stopping it from spreading. Containment is key and right now is our top priority. As this process takes place, the government of Nunavut will continue to support the community of Pond Inlet. I also want to take a moment and thank the municipality of Pond Inlet and its residents for allowing me to answer their discussions earlier today on their radio.
Ullu me montu saktit sigaro mayonga manna yo kanu ilinga lerning ni mitsi matalimmi tan nuvajoana taasi mayok inutu titao yo kaniteli titao luni ammalu sule kanu iloangito ta ko to averna tulerina no pilerigator simayo nunalini lertut atulertit sivalleallu tikser martailit sinermi kammalu katirattarsimayanginni khawiesarpalleanermut taakko khawiesarpalleakanni hattalangammiyu taakko pitahakkanituinnareali nuvajoana tuttalinni taikaninunanganni kisani tamanna tukihangittu nunalinni sermarpalleaningani kammalu khuarsaarsimagutaugiahangittu taakko alu toovernartulerinamu kamagiartorsimayut iqqanaajaminni kamayut khawigasuarsutik nuvajoarnartumik nuqqartigasuartugulu siarmagunnarninga taana siarmartauteilinninga piluanguartuq maannaujoq sivulliqpaujissimaneartavun tamannalu khilamiujaagani Nunavut gavamakkungit suliikayorsuinginnalangajut missimatalimmmiunik ammalu khuyannamikeinnarumajakka nunalinni gavamakkungit mitsimatalimmi ammalu mitsimatalimmiut kiuqattarunnaqhaugakkia persuqattatillugi ullaa naalaw tikku nunanganne.
Moving forward, I would like to remind all Nunavummiut in the strongest possible terms that every single social interaction carries a degree of risk. Despite all of the government's of Nunavut's preventative measures and the new containment measures in place within Pond Inlet, it is not possible to predict where or when COVID-19 may be detected next. I urge all Nunavummiut to exercise a high degree of caution and to seriously consider these risks before participating in a gathering of any kind. If you think it's necessary to participate in gatherings, please keep track of the people with whom you interact, as this information may be needed in case contact tracing needs to be conducted in your community.
Sivu magiarnaartilluta iqqaitit sigaarumayoa Nunavummiulimaanik sangiinerpaakut taakua hanutuinnatsaaq inuuqatigiitsinnik qatisirattарнеq ulurianarutaummat Nunavugavamakkungi tamatuvinga nuqqartitsimagasuaqaluartillugit ammalu siarmartitsittailit vallialertillugi mitsimatalimmi taakua nalunarnga sivungagu hanur nuvajjuarnaq 19 namiqaujaukannerunarmangaaq ajauttoriarqakka Nunavummiut taimaak ujersutsiallaarihullugit ammalu taakku ulurianartumiititsiniang Iqaluarmangaata ilauqataulaunginnermini katiqattartuni ilauqatarugiaqarsoriguvi katiqatigiittuni taimaaq hawisap siaqattarniaqquti kikkunni katiqatiqarsimammangaapit taakku atuutiqalirayanngata suurlu nuvajjuarnartaartu hawisartau vallialeqqata kikkunni katisisimammangaata nunatsinni.
Health staff cannot get us through this alone. How well we do and where we go from here depends on the actions of every single Nunavummiut. Right now, the best way of slowing the spread of COVID-19 continues to be through social distancing and effective hygiene. If everyone follows these rules together, we can put ourselves in the best position to make it through this uncertain time. It's more important than ever that we be careful, responsible, kind, and supportive. And I'd like to thank Nunavummiut for their continued cooperation and understanding. Koenami.
Anna hamnai tulirikku qanayartingi taatsuminga inutuutigunnagimmata hanuiliurunnarniarnivut ammalu hanuiliurutiqarniarnivut tungaviqarnianga hanuiliurutau vallianinginni Nunavummiulimaatiat maannauyortaimakaunerpaanguvuq sukkailigiartitaugunnarninga siarmaqargunnarninga tanuvajjuanaq 19 inuqatigiit qanigiiluattaileqattarlutik ammalu salumatsiaqasuaqattarlutik taakku atuagaujut malittainneriguttigu atangerluta akaunarnerpaakuurunnartugu maannauyor nalunartukkuurutiqartilluta inuusitsinni pimmariugiallaleqhulli maannaujersutsiariaqarnivut piliritsiariaqarnivut tunganariaqarnivut ammalu ikajoqatigiigiaqarnivut Nunavummiut quyannamirtakka ikajoqataunginnarngata tukisiumatsiarngatalo.
Ken Driscoll, APTN National News. Dr. Patterson, yesterday you were hopeful that those first 20 contact results from Pond Inlet would have been processed last night, but you didn't mention them in your remarks. Where are we at with those tests?
Ken Driscoll, APTN kunnik luta Patterson ipatsoqalauquvitaakos vullerpaavati hawisartau valle ila hawisarutitsangitikkinnernerarsugi mitsimatalimmiingaartu taakkoa qanuilingaleqqan.
As of last night, 13 of the swabs had arrived. 13 of the people had needed gene expert and testing in the south, and those swabs were completed. Preliminary results are negative. The swabs are carrying on to get confirmatory testing in Ontario.
Taakko tikilautu 13 hawisaqatsauju taakkununga sunakkutaamu gene expert mut hawisartaulortu ilunnatik taakko nuvajjuarnartoqanginneartaussimayuugaluat kisiani suli nalunaartautsiaqullugi suli aullartitauniartu Ontario mu.
I'm wondering if that's good news or bad news, because it's obviously good news for the 13 people who probably don't have COVID-19, but getting a positive result on that, wouldn't that have helped with your investigation to find out where COVID got into the territory? I'm wondering, from a medical point of view, how does this help or hurt your investigation?
Taana tusaqumina qabbalu tusaqumina loangila taakkununga 13 tusaqumina tutsaujuugalua kisiani Hanong naluna tau valeaninga tatsuma naluna rotigimau hanu tamanna mitukiraka.
This is good news. This is all around good news. It means that it's easier to maintain isolation and containment, to break transmission, and that is our first priority. I'll let the translation happen. I'll continue on.
Tamanna tusarumina lagitu tusarumina tsiarto taima suli malitsiato arutani teili manermik katisi teili manermi taima tamanna serma palle nginersaugunnangan.
The other question that is on everybody's mind of how COVID-19 arrived in Pond Inlet is a separate matter. That's a source case investigation, and that's where we look backward to see where this individual or how this individual was exposed. And that requires different work to do. And if we can figure that out, and if we're able to figure it out, we will announce it and we will explain how and find ways to reduce the chance of it happening again. But right now, the best thing we can do for the health of residents of Pond Inlet is stop transmission.
Tamanna hano kikulimano apikuti manuva joanak 19 tikita ng mga tanali imiku ngammat amalo kingamu takugera hamna rata hano tana katijak ng mga nuva joanak tumik tako imiku pilira ngugera hamna to hawi yoga soarlo ti hano tikin ng mga hawi gutan nalunayat siya kaswara yakta vutay matay may kanikhuyi na guamalo mitsimatal minuk hakita hullugo siya mapalagon ng ninga.
Koyanamik for the interpretation. One more. Just wondering, how many emergency response teams would you be able to handle realistically? Like, there's just, right now it's one case in Pond and you have 3 nurses with someone helping them out. At what point does that begin to be hard to sustain? If it happens in 2 communities, 3 communities, major outbreak, minor outbreak, at what point do you need to start getting help from the south?
Tako ale hano tuaver naktukku tikiti tausi mayu tako pinga sulu ti anna siokti kayokti hasuti tatsu mga mitsi matalim mo aulakti tausi mayu taimale hano asingin nununalin no siya mapalalam na ka taima hano tigi aulakti tsikataron na yakimako nununalin no pinga sunod lunit ambalo hangak ko halunani kayokta uga hasigayakisi.
Depending upon the size of the communities, we could have up to 4 rapid response team operational in the field at one time.
Nunali ang iningi malitugi tako sita mo nunali no si magunaktu imiko ngayon tako tuagan naktu lirigaktu tu.
Rajni Sharma, Nunavut News. Dr. Patterson, yesterday you said there were close to 20 people who were getting tested and have been tested due to contact tracing. Has that number increased since the time you've updated us?
Sharma Nunavut pivalya kunik luta Patterson tako avatiu nikalaw kavigi tako katisisi man niak suriya yutat si mga nuvat juanak tas mayumik tako amisunguraks maban.
I'm not sure. I don't know what they found with their work today.
Nalugriya kata na ulumi hanu ilo mga ta tusalo alawngin nama.
By any chance, do you know if they have moved out of Pond Inlet for contact tracing, or is it still within the community?
Kaya mavita ko mitsi matalim may naksuli katisimayangin ni kaya sakpaleavat ubalo nunali asingin ni kaya sakpalealigiban.
All contacts named on the list are still known to be within the community of Pond Inlet.
Tako katijamin nilimangi titirataw si mayilo na ti mitsi matalim mituit.
Jackie McKay, CBC News. Yesterday the number we talked about was 20 tests, and then just now you said 13. The results of the 13 preliminary tests have come back. Why is it 13 and not 20?
Jackie McKay, CBC kunnik ipatsaw kalaw kalaw kaviapat yung nakasugita ko kaw yung saktaw gutingit Tako leo khalekau migabe 13 ngunaksugi tako khano temeitung.
It was close to 20, whatever, we can quibble all we want. Not everybody on the contact list, there was a decision tree of who would benefit who would be likely to get a positive test on a gene expert. And there were some people who had very light exposure or were very early on, and we felt that gene expert testing wasn't appropriate.
Tako avatika sauna ratu inalaw taka ila naluna simalari nagi. Kasi tako nga tayo nuvadyo nakta runaw neksanik Hawi sa ko malaw nga tatat sa mga sunagkutangan ng gene expert mo hawi sa ko tawag nakto ni tako ilang ikatikay nagalato inaktamin ng ubalo sibong mariakan nga katitamin ng tako hawi sa tawag nginaksaw sa malaw nga ta.
There's a lot of rumors going around, as the Premier said, to help people determine what is true. Can you give us some details on how the government will be informing the public about confirmed cases?
Tako suling ito nito sa naktupalo hatalit sa utigim matay masibulak tiyo kakamat. Kano Nunavut kung inalo na sa katalanga banadle sulim mga ta malo kano tusatit sa katalanga bisi nuvadyo naktakto kapalya tilo.
Our plan is to announce every confirmed case within 24 hours, and when we have concrete information on how they caught it, we will include that as well.
Pamasi mabiyugo tayo nalo na tayo kapalalang na ikakay 24 na ito ay patat tusaktit sa katalo ta ang malokaw ito ako ta kano ta ko no badyo na ta to ng mga ta tusaktit sa tigilang miyugo.
There's been a lot of talk about, with Pond Inlet, there are chokehold points for flights or communities that have to travel through other communities to get there. Is, at this time, the government of Nunavut considering doing mass testing at those points?
Mitsumatala mo palalo ni ako sa kasung mata singin nunalindot. Tako Nunavut government kung itay ko na ni ako sa tao kata hasmayo nunalid no kaya sa palani usagiban.
No. Mass testing in a case like this where we don't even have evidence of community transmission would not be appropriate.
Aga, ami suni kaya sa palani man nato ti kalwa kayang manalo na tao sa mayo haktin nagu siya mapalyan lakin ni ani.
I'm confused. Do I get more questions, or was that up? Yeah. So also we talked about the isolation coming back into Nunavut. Is the GN considering doing 14-day isolations for traveling between communities?
Can you say that again?
Will there be required isolations for travel between Nunavut communities?
Oh. Tako ani telis magya kanuna vumiasing inunalin no tikin ne arotik nuna vumikalo alo te ulo ni 14 ani tele hatara amneriba.
Not at this time, but our recommendation is that there shouldn't be non-essential travel between communities. If we start to see transmission in multiple communities, we may have to look at something like that, but not at this moment.
Mana yo aga yo tako pimari la pidyo te hangilo tinuna lina la kata ko jingin at nuna vuelo ani ugalo akisani sa mapalla alam na kasing nuna lino tay ma akitsito na kakayak tigo.
I'm a Trantor Nunavut News. Dr. Patterson, can you tell us how many new people have been tested in connection with the Pond Inlet case since yesterday?
I'm a Trantor Nunavut News. Dr. Patterson, hatsiyo si mabata ko ano ta how yisaktaw gyakak si mayum tapani.
No, I can't. Sorry, I wasn't able to get an update on their activities today's activities so far.
Agaw ako nang itong ulo mekano iliw ko mga ta tusa kaya ako naksakawin na mga ulo mekano iliw ng mga ta.
And for Pond Inlet residents that are outside of the community right now, there's a 14-day ban on flights going into the community. what's being done to support those residents that aren't at home right now?
Tako mitsi matalimio sila taanitu ila nunaminni ngittu tako ulluni 14 tikibiu taili kei naqayaqarsi mamma qangatayunu inutartunut taikua qanu leikajortauva taikua unitsimayut balu mitsi matalimio tappaani ngittui.
The people who are in the isolation hubs from Pond Inlet, we've gone through the list, and there's a few days before the first one would be flying north that we've identified. We're going to be working with them. It's their choice to either stay in the isolation hub or come to Iqaluit and stay in Iqaluit until it's safe. There are a few people in Iqaluit on medical reasons, and for now they're staying here. So we're supporting them in staying where it works best for them.
Taikua tuyo mebimitu aniteli titausimayo mitsimatalimmeo takuyausimayo atingi kikku mangata ilangi utekpalle gunnarsineale qalawaqsuti tamaunga kiortartumut kisiani piliriqataut siartut taunaniituinna kainnarumammangata qallunaani ubbalu pivirartitaulluti qalunnu tamaunga utaqqigiarturunnartun tamaaniittoqarmimma qalunni mitsimatalimmeuni annaarbilearsimayuni taima tamaani kainna titautuinnarniartut ammalu piliriqataut siarluti ikajorsortaut siarnaarmiu.
If somebody is out of town and absolutely needs to get back into Pond Inlet, they can put in a request through the CPHO travel requests email, and we'll work with them to try and support them in getting back home safely.
Takwa utiruman katamitsi matalimmo tutsirarunnartu taatsuma allabbingatigu tutsirarunnangata aullarunnermangaamik ikajortaugajartu utiriaqallarippata attanangittukku ikajortaugajartu utirpalliagunnarningi mitsimatalimmo.
This might be a question more for the Premier, but I'm aware that each hamlet has been sent a list of projects that were to be completed in their community this summer. If the projects don't go ahead this season, can you talk about the financial risks to the GN and some of the public safety risks that might come up now for if these projects were to go ahead? Just wondering if you can tell me more about that.
Sivullertimu taanna apeqqutitaakkuagu haamlakku titerabiussimammata titera ila kisunik pilireanguneartuni sanajaugiaqarniartunik aujaq taakko pigiarunnarsingippata aujauneartu hanuor taakko kiinaujartiguut asiujigunnaqqa Nunavut gavamakkungit tabbulau attanaluaqqa kikkulimaanu taakko kayussikutauppata hanu tamanna nalunairunnaqqiu.
Thank you. Yes, a request has been sent out to the hamlets to see if they want workers from outside of Nunavut to come in to start either new projects or complete current capital projects. And once we get the results back, then we'll go from there. And there are some contractual obligations that may have to be met if the hamlet chooses not to have any workers from out of Nunavut come into their community, either start or finish the current capital projects in communities. Ita naman na yotako hamla kut aperiyaw himang mga ta hanayin Nunavut mutang witunit auyak tikitichi ila tikikoyin mga ta ubuluba tikikoyin itut tako hanaga to ayak to igdor kalne kuna mamle angi yuni pekotelyo ani amma kawin na to takwa pekotelyo it hanayo ayak to hivumoangi pata ubaluba pigangi na pata takwa government kut akilihin na kaya to takwa hanayak kata alautun contract alautun.
Just to follow up to that, are there mitigation plans in place for those proposed projects right now? Now that we do have a confirmed case, has anything changed if those were to go ahead?
Taanailaga kannerluga peqqutinga taakwa pigiartaugumaneartu piliriat hanu asijjeqqataana nalunaataussimajoqalertillugu nuvajjuarnartoqarningani tamaani.
It's still too early to judge any projects by this one case in Pond Inlet. So it's an evolving situation, and we'll be dealing with all the projects on a one-by-one basis, but as a whole when the time comes. Tāna mana whāna ayoktu piga li halo ma tāna tau hit nā ngumās ni tāna nuban na yo 19 kāpto mitsi mataling mi tā kua pilere kau na yaktu pekotel yo at ana yo gali igdor yo at huna mea Nunavut iloani au yak tāpa ni kahit yo aig mahuli so tāna pilere ni alo tawut.
Kent Driscoll, APTN National News, lines for the Premier. Last time I was in Pond Inlet was last year in August, and a big project that was getting underway there was they're building a small dock, and it's very anticipated in the community. With this case of COVID-19 in the community and the lockdown conditions, is that project going to continue?
Tāna Kent Driscoll, sivulerti mo apiriyok, kingulerpa mi mitsimatalim mi lausma yo agis ngutillogo, angi yo alum mi sana yo hakpalle matana tulatta bitsak. Tāna lo nere ya video asuni tāna nukhak titaw na katapani nubanjo anak to kalangan.
If you were to ask me if the workers can come in right now, no, they can't come in right now. That's obvious. We don't know what the situation will be like once the ice melts and whether they will work on the marine infrastructure or not. The municipality of Pond Inlet is one of the communities that will be asked that very question, and we'll go from there. Mana yo takwa hana yi mitsi matiling mo ni itang na ayo kayak to mana yo ki hani takwa tao ka mitsi matili hambe kuni apere yo na may au yo na to mitakwa Nunavut hidatani hana yak to ni kaya ko yung mangata tan au yak pa ki hani hana yo mga yang matan ikab yo na mitsi matiling ta na mana yo kiyo ni ayok taka.
Since yesterday, one of the common refrains coming out of everyone up there is do not shame and blame the patient. But when you go online, you see a mix. You see people who are being very supportive of the folks in Pond Inlet, and you see people with conspiracy theories and outright xenophobia. I'm wondering, in your opinion, are people following your instruction to not blame and shame the patient?
Ipatsani tako kakatalaw at si tako kang usari hunagit ang malupasiya sa utitsi hunagit tako nasimayok tayo maharisaw yaku ilangi ikayok suit sa akto ilang ilo sulingit to ni titira hatak to ibili sumagayang agutako malit sa ka ibitilis igutigilaw tangin ni.
Thank you. I think you kind of answered your own question when you said that both sides are on social media, and my job here is to encourage the positive remarks, not to shame or blame. Don't make any speculation of where, who, how, when this COVID-19 came here. As I stated yesterday, nobody wants COVID. Nobody wants to bring it on purpose. Nobody wants to spread it on purpose. So we just need to give support and kindness to the people that have it. The one person that has COVID, that person didn't ask for it. It just happened. So I want Nunavut just to be good citizens and caring citizens. Tāna apakoti iyay kiyokortain tāna kalao mitako ilangit kakitaw yaku kaktamata huinani ilangit pitchana nagdinaktoni tāt kwa tamaini kaktamata kihani nunamiut kaujuwakta katakwa anyang naktunik pahigiyak hanik kataktigin takwa ikayulang imata tanali anya nakakto no 19 mit anya wang ilaw piyari suni tan anya ne kinamer mo aiktor ni lulang ita tan anya ne kinamer mi kitumer no tan tikitu luaman kihani takwa anya nakakto ikayo lavut pitcha lavut nagligilugi takwa no miut inokati ni nagdigit naglihugo tarapta tako nagdigit chalugit ikayok tulugit amma uqaqtangil ta tan anya ne umaw nakhalaw ko ta taika nga kay ko ta kwali ta piliri no ta nakawin na ko makawin nakpat Dr. Patterson khalaw makawin nakpago nakipilaw mga hakiting umakta.
Queen, one more question, and I'm not sure if this is better suited to you or the finance minister. with the announcement today of the suspension of the Assembly for the spring session. I'm wondering if that limits you or ties your hands in any way when it comes to additional spending to try and battle the COVID-19 problem.
Thank you for the question, Kent. I wouldn't say it creates more of a challenge. It delays some things, especially if you're looking at carryovers or any additional appropriations. We do have the authority, or I have the authority, to do special warrants, as I've done a few already, to deal with this crisis. And if need be, I would have to continue that process. I am doing my best to keep the full caucus informed of any decisions of that nature, and obviously we work with our regular members caucus very diligently. Probably more challenging, Kent, would be the legislative process of legislative proposals that we were planning on bringing forward next month, and obviously Bill 25, the Education Act. So delays in some of the legislative process to me are more concerning than the financial process. And with the Speaker's announcement today, we will look at options going forward to see how we can make sure that we continue that work.
Jackie McKay, CBC News. We're getting a lot of questions on Facebook regarding teachers leaving for the summer. People would like to know if teachers leave when they're done working for the summer, if this new order that you have to pay for the hotel isolation, is that going to impact them?
Thanks for the question, Jackie. As we just made this announcement, we're still figuring out some of the fine details, teachers, other residents of Nunavut, and how this is going to work. So we will have more information. Maybe I'll have information sooner than that even. When we look at, sorry, yeah, I got mine over there. Maybe part of this question might have been better answered by the Premier. More details will follow, obviously, but one of the things that we want to make sure is that from any Government of Nunavut employee, we don't know when those isolation hubs are going to continue to be needed. So this is going to be a little bit more fluid, but the teachers did come up as a specific topic that we will look into.
Huyan na mitana nalo na tao kautilugo suli ilulingi nalo na yak tao ya hangata takwa ilin na tit sijid asing ilunu na vumute ambalunu na vuga vumakungita kana yak tingit nalo na ngata ko hangaku atu na win na ya hamna mangata tuyong bibi hangat asid jakta na lang ayo takwa ilin na tit sijid kamagiyang oh kamagiyang siya Langam medyo ikayok tao luti kano ikayok tao gunam nilimangin.
Great, thank you. We're also wondering if the GN can say how much they have spent so far on isolating people in hotels down south.
Nunavut makungi hauye malekha khanu tigikina yaktosimama tatakuno atoyo mevinno khallunani.
From our last invoicing cycle, it was around $2 million, but we are expecting some further invoices to be coming in from the last couple of weeks. Thanks, Jackie.
Takko aking ulakpa me akilik saliok taulok to 2 million gulok to mako no pinasako sa ino to yung mevinni.
We've also heard from some people, specifically a healthcare professional in Iqaluit who's been trying to bring their partner who lives in Labrador up to take care of their small child and has been struggling with a hotel quarantine. Would they be considered to get support for their father to join them in Iqaluit, and with this new order, would they have to pay for that themselves?
Tusakse mamma takko ilangin ni solo anna bimikhan ayak tiyo yung may kalun ni ay panganagaw tikitit siya sa kalawang nga kitong kalangan nilo kalunani to yung bivimi tayo utilawin tamang galawin ningin ni tayo malayin mini akiligya ka na halaka.
Thanks for the question, Jackie. Obviously, I can't get into one-off specifics on a case like that. I would suggest anyone that has an issue such as what you mentioned, contact the CPHO travel request at gov.nu.ca, and each case would be looked at on its own merit.
Takko ilulingin no kausa kaumang ito nga tayo maimiko tunik kisa ni tayo matut siya kung nakto tatsuma luta CPHO travel requests at gov.nu.ca mutitirak lutik takko ato na kinakuyaw katalang ayo tut siya kautiyo yun.
And then I have one last question for Dr. Patterson. Thank you, Dr. Patterson. For the rapid response team that went to Pond Inlet yesterday, did that team come from Iqaluit? And then the 4 other teams you were talking about that could possibly be deployed, would those also come from Iqaluit or from down south?
Dr. Patterson takko ato birnakto ni piliriyak to titaw mitsi matalimut. Nakalun ni nga nakat takko alo sita may gumnam nakakaw yati asingin no nunalin nakalun ni nga kayakiban.
One of the staff who went to Pond Inlet is from Aviat. The rest are from Iqaluit. The other staff are people working around the territory who could be redeployed as part of this. This is the numbers that we have are staff that we already or currently have working in Nunavut.
Tan tapo nga katawlak to ilang ay kanayak tiyak vani ngaktok tako ilang ay kalunni ngakto inaulutik tako asingin ni nunalin ni kanayak to nunavumi tayo ma angir si mayut nunalin no kita katakon naklakton.
Emma Tranter, Nunavut News. Dr. Patterson, can you tell us exactly when you got the cartridges for the Gene Expert machine and how many do you have to do testing for COVID-19?
Emma Tranter no natsiakum ni Dr. Patterson tako akatsanik kaya saktaw gutit sanitatsu mga Gene Expert mode atok taw gunakto ni pisima bisi.
We got the shipment of COVID cartridges sometime last week. The validation work, the work to get it set up and working properly and confirm that it's reliable, finished on Monday. And last I checked, I think we have somewhere around 80 cartridges, enough for 80 tests, and have more coming on the way.
Tako apiya miningi nuwadyo anak 19 mo kawi sa kutitsaw yun pinasa ako si yuyumi lalo na yaktaw ka sa talakotako at ang makatang ikalo ang mga tapiya kayaktaw lang ito ni nagkadyaw mi. Tako manaw yung 80 ni kami akuli kawi sa kutaw gunak ito ni amal niriw ito tikibyo kanila nga ta.
Probably a question for the Premier, but if you apply before May 7th to go into the quarantine hotel, are you still, and say you apply before May 7th, but you get admitted after May 7th, are you paying for your stay? Or is it if you apply after May 7th?
Sibulak di mo ta napik ko tita ko at utsiram na kata tuyok may vimo ko mayo ikaluna ni May 7 tungagot suli akiligya kakayakan.
Thank you. think in my statement I said if you leave Nunavut after May 7th, then you'll have to pay for your self-isolation. For anyone that's, it'd be looked at case by case depending on when that person did leave Nunavut. So each case probably would be judged on its own merit. Tana utsa kalaw matana akilit tang hinik taw mi kablunano na intro hibing mi. Tana pigyaw na Nunavut mi utanut May 7 ungatani Nunavut mi outlook tunun. Takwa tauna ni ranik tunun kablunano na ni takwa ataw ko talawila ila ko talawit kaiban ko ataw yak tang na put kanu akunyu tigitawan ni mga ta makanga uktok hima mga ta hinik taw mi terwaslutin.